Did you know that according to Dr. Scott A. Hardison, doctor at the University of Medicine College in Richmond, Virginia, that 4 to 5% of the pediatric population suffers from something called subglottic hemangioma. This makes it the most common type of head and neck tumors in children. Perhaps you or someone you know has dealt with this diagnosis before. If not, I'm hoping to give you a better understanding of what it is and how it impacted my life. In this speech, I will be discussing what subglottic hemangioma is, how it affected me in my life, and how I learned to deal and adapt with it. I'm sure many of you have never heard of this before, and you're very confused about what I'm talking about. Let me give you some information and background for a better understanding of subglottic hemangioma. According to experts at the Children's Hospital in Philadelphia, Pennsylvania, subglottic hemangiomas are benign tumors that often form large masses in the airway below the vocal cords. They also state that they're most common in infants and children, and they almost always need medical attention. Signs and symptoms of this include noisy and difficulty breathing and coughing a lot. Treatment for this includes laser surgery or open surgery. I was diagnosed with subglottic hemangioma at the age of 3 weeks old. It began to get worse and worse. The doctors informed me that these little tumors were now blocking off my airway. As a result from this, I had to have a trachea put in. This was very difficult for me and my family. Having to deal with the trachea every day and seeing me go through hard times was very difficult for my family. I was unable to speak with the trachea in for 2.5 years. I had to learn sign language so that I could communicate back and forth with my family. During my lifetime, I have had some consequences because of the trach, but I have learned to adapt very well from this. At age 2.5, I got the trachea taken out, but the doctors informed me that I would never be able to speak, that I would always be last in my class. It would be very hard for me to catch up. But I am proud to say that I finished top 10% in my class and I proved the doctors wrong. Today, as you can tell, I deal with a very soft and raspy voice, but I've learned to deal and adapt with it very well. The result from the laser surgery was that I have to deal with this raspy voice, and I have a scar and some birthmarks. However, I grew up in a very small town. I knew everybody in my town. Everybody was very supportive. They knew what I went through and they knew how I dealt with it. So I was never treated differently. I got along with everybody great, and it was like nothing had ever happened to me. In conclusion, in this speech I discussed what subglottic hemangioma is, how it affected me in my life, and how I learned to deal and adapt with it. Hopefully from this speech you got a good understanding of what the diagnosis is, and you got a better understanding of who I am as a person and how I grew up in life. You never know what people are going through in life, so just remember, always be kind to others.